So I want to show a couple of different variations for a squat. And this can be regressed or progressed depending on where you're at. This is a great beginning position for somebody that is having pain, dysfunction, maybe weakness that's not allowing them to get into a good squat position, get up out of a chair, things of that nature. We talk very much so about function in our practice and how being able to squat is essentially being able to get out of a chair, get up from the toilet, things that create independence. So if we have pain or difficulty doing this now, it's something that really should be a priority to address. Now, this is a great position to start with, again, using a chair. Now, if getting up from a typical standard chair height is still difficult, again, whether it be because of weakness or be because of pain, we can use a foam pad, we can use a pillow, we can pick a higher surface to sit on, which is going to decrease the range of motion and also decrease the demand in which you need for muscle purposes to be able to actually accomplish that position. The other thing too is that you can use, we have a dowel here, you can use a dowel. You can conveniently position something that's not gonna move on you, like a chair, your countertop, to really help you get up out of this position as you start to retrain your squat. There's a few things that we look for as far as one, like being able to keep like a good, like tall posture and neutral spine. Being able to kind of hip hinge and progress that weight forward, but also hip hinge. So kind of start by sticking the butt back and coming down. This will help to really engage more of the posterior chain, the glutes, the hamstrings, versus just driving forward with the knees bending first and then shifting the hip back. That can put a lot of pressure or strain on the knee too, for folks that might have, again, knee pain. So I'm a big fan of using something for assistance to start to train our body through that limited range of motion. So it's not cheating if it's helping us break out of compensation patterns that are not helping us anymore. So again, I have some assistance here. I'm going to inhale first. I'm going to exhale. I'm going to stand up nice and tall. I'm going to inhale. I'm going to drive my hips back. I'm going to sit, exhale, come right back. Another common thing that we see too is folks will, when they have weakness in the side glutes here, or weakness in the quads as well, what can happen is as you go to stand, because there's not a lot of stability through the hip abductors, these muscles on the side, the knee will cave in and kind of come out. So if you see yourself doing something like this, that means we got to work on your hip stability a little bit more as well. So try to root your foot into the ground. Think about screwing your foot into the ground, giving you a good solid base, and that can help to drive those knees out and not have them cave in. Once we get that hip stability a bit stronger too, getting your hip strength up a bit, that knee caving in will be less. The other thing that you can do is you can put a band right above your knees as like a little cue to just drive your knees out, and that can help you kind of train that squat position. So give this a try. Shouldn't reproduce pain. Use whatever you need to kind of stack up to decrease that range of motion that you're squatting through.